Regular health checks are very important for everyone, especially when it comes to cancer prevention. Cancer is a serious disease, but if caught early, it can be treated better. Here are some medical tests and symptoms to be aware of. One common test is a blood test called a complete blood count, CBC. This test checks your blood cells. It helps doctors see if there are any unusual changes. For example, a low number of red blood cells may suggest anemia or other issues. If you feel very tired all the time or have unexplained bruises, it's good to ask your doctor about this test. Another important test is the mammogram. This test is for women and helps to check for breast cancer. A mammogram is an X-ray of the breast that can find small lumps before they can be felt. Women should start having mammograms at the age of 50, but some may need to begin earlier if they have a family history of breast cancer. Symptoms of breast cancer can include a lump in the breast, changes in the shape of the breast, or unusual discharge from the nipple. For men, a prostate-specific antigen, PSA, test can help to check for prostate cancer. This test measures the level of PSA in the blood. Men aged 50 and over should discuss this test with their doctor. Symptoms of prostate cancer can include difficulty urinating or blood in urine. If you notice these symptoms, see a doctor quickly. Another key test is a colonoscopy. This test looks inside the large intestine to check for polyps or cancer. People should start having colonoscopies at the age of 50. Symptoms to pay attention to include sudden changes in your bowel habits, blood in stools, or unexplained weight loss. If you experience any of these signs, a colonoscopy might be necessary. Skin checks are also very important. Using sun protection can reduce the risk of skin cancer, but it's also crucial to check your skin for any unusual moles or changes. If a mole is changing shape, color, or size, it could be a sign of skin cancer. It is advisable to consult a doctor if you notice any changes in your skin. There is also a test for cervical cancer called a pap smear. Women should start having these tests from the age of 25. This test can find changes in the cells of the cervix early on. Symptoms may include abnormal bleeding or pain during sex. If you experience these symptoms, see your doctor. Regular exercise, a balanced diet, and not smoking can help reduce cancer risk. Eating more fruits and vegetables, and less processed food, can keep you healthy. Being active can improve your overall well-being and help prevent various diseases, including cancer. Lastly, understanding your family medical history is crucial. If someone in your family had cancer, you may need to have tests earlier. Talking to your doctor about your family history can help them give better advice on what tests to have and when. In conclusion, regular medical tests and awareness of symptoms are key to early cancer detection. If you notice any changes in your body, do not wait. It's always best to get checked by a healthcare professional.